Hey, lovely people, welcome back to my channel. If you're new here, my name is Queen, and this is another episode of Living with Purpose. I'm so excited today because we have a special guest who is amazing. So I'm just going to read her bio and we're going to get right into questions. So Mrs. Faith Adole, she has her master's in nursing as well as and she's also a family nurse practitioner. She is the president and founder of the UVOL Foundation, Inc., a healthcare nonprofit organization dedicated to bridging gaps in healthcare worldwide. She has served in various nursing and healthcare leadership roles and is also an experienced nurse practitioner. She has over a decade of combined clinical and leadership experience. She is both a wife and a mother. Wow. So welcome, Faith. Thank you so much for being here. So we're going to start off with the first question. When did you know you wanted to go into nursing?
Sure. Initially, I didn't know that I wanted to be a nurse. I always enjoyed, science courses and biology, and I knew that I liked helping people. So naturally, I thought maybe I should be a doctor. Um, but I had a very big challenge in high school. I struggled a lot in my math courses, and I kind of just lost confidence a lot along the way. And I felt like, how could I even make it in medicine? How could I even get into the kind of schools that I want to get in? So I kind of put that on the back burner, and I decided that I need to get my grades up, and I went to a community college. So it was when I was in community college and talking to, some family members, some friends, they were asking me what it is I wanted to do. And I'm like, I'm not really sure, maybe teaching. And they're like, why teaching? And I'm like, well, you can help people with teaching. And I feel like there's, I told my family member, there's not a lot of math in that. So I think, that'll be okay for me. And I saw that she kind of looked at me and was like, so you're kind of settling, she asked. And I'm like, well, maybe yeah. And then another day she was like, babe, have you thought about nursing? And I'm like, no, I really haven't. And she's like, I really just feel like that aligns with who you are. And you should look into it. Nurses are doing some really great things. There's a lot of avenues that you can go into. So I did. I did read on it and research, and I really liked it. And I was so surprised all the different areas that you can go into and what you can do, and how it's a very much a empowerment role of advocacy for patients. Um, it's a role where you can just be with people at their worst and really pour into them. And I think that's what drew me. So it's at that time, and then that led me to uh, a vision that I had, which was really unexpected. But I had a vision by way of a dream. And I had this dream 3 times, 3 nights in a row. But the first night, it was just, I saw myself working as a nurse on the mission field. Um, yeah, doing missionary nursing in kind of a leadership capacity. Like I was telling people what to do, and I was orchestrating things. And I woke up and I thought, wow, what a neat dream. And that's really awesome. I don't know any, missionary nurses. I don't know much about healthcare missions. I had that same dream 2 more times. So by the third time, I really felt like this is divine, this may actually be my calling. So it just further encouraged me. And that's really why I went into nursing.
Wow. And that's awesome. So you had a dream 3 times. So God was just basically saying, listen, this is where I want you. And
Absolutely.
so as you're beginning your journey, did you have any resisting moments and how did you overcome?
Yeah, definitely. I felt that my resisting moments were very much internal. I describe them as battles in my mind. Like my mind was a battlefield for me. And
Wow.
so I think I touched a little bit upon in high school. I dealt with a lot of uh, um, but low self-esteem, lack of confidence, those types of things. And so early on, doing prerequisites in the community college, getting ready for nursing school, I had to really overcome that. I thought that maybe, I had an academic problem. Maybe I wasn't smart
Mm,
enough in math. I didn't really have a reference of women in math or sciences doing really well. And I just felt like there was a disconnect with like, I really enjoy what I'm reading, what I like, but then when I take tests,
mm,
it didn't translate. So um, I took practical steps to work on things like self-confidence and my academic performance. Specifically, I took courses in time management, learning how to manage my study time. I took different courses on, it was called test taking strategies. And these were all non-credit courses, but they were self-development courses that were offered. And also during this time, I felt like my faith, just understanding who I was in Christ, I became born again during this period. I
mhm,
was about 18, 19 years old. And I began to just read about what God says about me and
mm.
who I am and how he sees me. And then I began to see myself that way. The more I
Yes.
spent in his word, um, that, I saw myself in his image. So those were really the things that helped me to overcome those internal obstacles that I faced, really.
Okay, so tell us a little bit about your journey to nursing, to getting your NP.
Yeah, so when I was taking my prerequisites, they were prerequisites to get into a bachelor program. So I did transfer from the community college into a four-year university where I obtained my BSN. And then during my BSN, I began to learn more about nurse practitioners. I actually had a professor who was a nurse practitioner and
Oh,
was a
wow.
clinical instructor, which I'm still in contact with her today, but she made a really big impact. She was
Mm,
actually my community health professor and clinical
wow.
instructor. And I just thought she was so neat and cool because she was also a nurse practitioner and I never met, a live one. So I was like, oh, wow, like, so I used to ask her, I'm like, what do you mean, like, you diagnose people and all of that, but you're a nurse? So she began to kind of tell me about it, like, okay, nurse practitioner is an advanced degree in nursing. You need your master's for it. And so I read and read while I was in my bachelor's, and I knew, oh, this is definitely what I want to do,
Wow.
especially if I want to get into advocacy and leadership roles and just have, more autonomy and more say for
Mm,
my patients. So after I graduated from my bachelor's program, I went back to my hometown. I started my nursing journey, very kind of typical on the hospital bedside nursing on a med surg floor. I went through a new graduate program, which basically kind of helps nurses transition from nursing school to the field. So you do a little bit of kind of some classes, and then half of the day, like the second half of the day, you go and work on the floor and you have a preceptor.
okay.
So that was about a 6-month program. You graduate from that and then you're on your own. So that's kind of what I did. It was very challenging when I first started, just dealing with real life issues right away. Everything from just having people's kind of lives in your hands, dealing with death and dying and all of that. So that's kind of how I started there. And I think I practiced for about 2 years. And then I went on to do my master's.
Oh, wow.
So the program that I did was a master's in science and nursing program plus a nurse practitioner certificate. So at that time, there weren't many doctoral nursing programs. It's either like, if you get a doctorate program, it's your PhD, which was really
Oh,
research based. But for people that are watching that maybe know about DNP programs or Doctor of Nursing practice programs that are linked with nurse practitioner programs. That didn't really exist back then. So you get your master's, and you can get a master's in nursing in various areas, just a straight general master's in nursing or a track in education, a track in leadership. But the track I chose was to be a nurse practitioner. So it was like an extra kind of year tacked on to the
Oh,
MSN
wow.
program. So that's kind of how basically I started from school to work and how I became an NP.
Cool. And so that's awesome. And it's good to know like there's different paths, and yours started with community
Nice.
college and then, a 4-year university, master's, and then the NP. So
Right.
that's really awesome. And so after you got your degree, tell us a little bit about your first experience, with patients.
Sure. I guess you're asking about, right away as a nurse when I finished my bachelor's,
Yes.
right? Yeah, so it was nerve-wracking definitely once I finished that new graduate program, and it was on my own, because in nursing you're basically put in leadership roles right away in a way because you have to delegate. You're delegating to LVNs. LVN is a licensed vocational nurse, or on the East Coast they call it LPN, licensed practical nurse. They're the same thing, just different terminology on different codes. And so you're delegating to them and you're delegating to your nursing assistants. And so right away, I was about 21, 22 when I finished, and I realized, well, first of all, most of my colleagues are much older than me. They're in their 50s, and I think
Oh
probably
man.
the mean age was like 55 or so. And so that was very interesting. And sometimes the LVN I'm delegating to is much older than me, or, so I had to get comfortable in that kind of role pretty fast. And then the other side of it that was a bit scary, I would say, is just I guess having the confidence that you're not going to kill someone or do something
Mm,
wrong, when you're pushing IVs and different medications and stuff like that. And it just really came with confidence, came with practice over and over again. So even when you're on your own, so to speak, you still have, your nurse colleagues and older
true.
nurses to ask questions and all of that. So you're never truly on your own. And what's interesting, shout out to LVNs and nursing assistants, those that have worked in the field so long, even if they're not an RN, since they work
Mhm.
so closely with RNs, they, at times, an LVN was helping me in my skills and saying that, I'm not licensed or able to do it, but, she would give me tips and pointers and all of that. And it was a real
Mhm.
team effort, and I enjoyed that. um, Issues with death and dying. Oh, I still remember the first patient that I lost, as a nurse, a new nurse. I did cry, definitely.
Oh man.
It was really tough for me because I never really experienced death that closely or in front of me. And so it was hard to deal with. And I think I got through that with just, again, my nursing colleagues talking with other nurses that have gone through that.
Mhm.
And sometimes in the hospital, they would have like, if a hard case, they'd have debriefing sessions and those kind of things. So you can just kind of talk through your emotions. And longevity in such a role as a nurse and seeing all those difficult things, I would say having good work-life balance was very helpful. So having an outlet to where
Mhm.
my life wasn't just work. So that's kind of how it started for me as a nurse.
Wow. And yeah,
Yeah.
I can't imagine, being young and, delegating tasks. They're like, what do you know?
Right,
so
exactly.
so it's
Yeah.
good that you got comfortable over time,
Yeah.
And I like how you talked about work-life balance. So that's a great segue into my next question. So
Mhm.
how are you able to balance family, your career, and everything else that you do?
Sure. That's a great question. Sometimes I wonder myself, but I honestly, I would say learning to kind of relinquish control. and asking for help. I would say definitely in being a mom and being a wife and having a lot of things going on, just willing to not, say, no, I don't have to do it all. It's okay to even delegate tasks in real life or ask for help or
Mhm.
reach out and say, I need help with, someone watching my kid or, I just need to go and have me time and do
Mhm.
self-care. So, yeah, I would say definitely just kind of relinquishing that control and allowing other people kind of in your life and your journey. I think it really takes kind of a village to raise kids and to have good mental health and all of that. So leaning on my family members, friends, and
Mhm.
making sure that I do a lot of self care. So taking time for myself, from everything, my health, what I eat, sometimes just going to the spa or anything
Yes,
that I enjoy. I like going to the spa and those kinds of things,
that's
but
good.
whatever works for you. So yeah, those kinds of things help me with work-life balance.
Definitely. Yeah, you have to treat yourself. You can't just continue going and going without taking care of yourself, you
Mm,
know?
definitely.
And so, I know we didn't talk about public health yet, but what made you combine nursing and public health? Can you tell us a little bit about that?
Sure. It's kind of embedded a little bit into my nursing journey, so I'll take you guys a little bit through that. So I worked initially, as I said, in the hospital, and I worked in the hospital for about 5 years, and then I made a switch into public health by way of home health, actually.
Mm,
And I really wanted to get into a leadership kind of role. So um, before I knew that I wanted to do that, I started volunteering in public health. I just knew I like public health. I want to work in public health.
mm,
And I went on a missions trip and I volunteered as an RN. It was a missions trip in Nigeria. And I worked as an RN coordinator at that trip. And I absolutely loved it. It was just,
mhm.
I'm like, I love this. This is me. I felt like I just thought it was an amazing experience to be able to I thought I'm being a blessing into people's lives, but then I was coming away blessed from it as well.
Wow.
So it was just an enriching experience. It's like doing what I love to do, and wow, I'm yeah, you can get paid to do this, wow, and and just be blessed by it, and it's definitely life changing. So that trip was very pivotal, I think, in my career. Because when I came
Mm,
back from it, I'm like, wow, I want to work in public health. I want to, work in training nurses and being in leadership. So I took a leadership position as a director of nursing,
mm.
but in home health. And I was less than 30 at that time.
Wow.
And yeah, I just saw it though. So when you see something and you want something, go after it. And I tell you what, when I read the job description at the time, I didn't have all the requirements. They
Mm,
were calling for, just different things that I didn't have yet. But I knew I wanted it. So I just said, well, what's the kind of job that I would go for that I'm not necessarily qualified for on paper, but I know I can do this. And I found that job and they called me.
wow.
Yeah. And, long story short, I started in that job and I loved it. And from there, wound up finishing my NP, worked as an NP in public health and in clinic setting. And my passion really drove me even more into leadership. And I felt called to start my own nonprofit.
Wow.
So I did that about 5 years ago, 2015, and that's the Yuval Foundation that I'm the president of. And really, I started locally with what I had. I always knew that I, wanted to do missions, back to that dream.
Yeah.
But I didn't know how can little old me
Mm,
do all of that. So I started with what I have. And so that's what I preach to people a lot. Just start with what you have, You dream, you pray, you plan, and then you move. So that's a personal motto of mine. And so I registered it. I researched how do I do that? I registered it. I had a mentor that had their own nonprofit, not in healthcare, but they just had a nonprofit. And so they're like, this is what you do, this is what you file, and all of that.
Mm.
Registered and started local. So at that time, I was in the greater Los Angeles area. I worked a lot with the homeless population, had a heart for the homeless communities, and we just started with homeless outreaches. So we do, hygiene packs, and we do health education, and we'd also feed them as well, and those types of things. And then I started working with the homeless communities a lot in shelters
Mm.
within Los Angeles, in San Fernando Valley, worked with some women's shelters there, and we did health and fitness outreaches. So ongoing. So we do health workshop classes like on women's health and hygiene and all of that. And then
Wow.
we do fitness classes, and I'd collaborate with who I knew, my friends. So I had a friend that
Mhm.
was a fitness instructor, and she'd volunteer her time, and just kind of started from there. And once we built kind of a little bit of rapport and our name and did fundraising, um, I, I then went overseas for the first time in 2016 and did my first medical mission. So that was my journey into public health and where I am
Wow.
now.
That is amazing. And yeah, public health is amazing, an amazing field that you can do so much in.
Yeah.
So it's just yeah, it's really amazing. And for you, what does public health mean to you? Because some people might be watching and they don't understand what is public
It's
health.
public
So
health.
what is public health to you?
Yeah, that's, as you said, you can do so many things within public health, but really it's just public health, community health, being in the public or community in some way, and helping in the area of health. So that could be anything from health education, speaking, helping with health programs, developing programs, implementation of programs. So a little overlap into nursing. So you could be actually doing health activities as a nurse, as a non-nurse, implementing, health practices. And so that's just a little bit of, I think, summary. It just means health wellness promotion, I would say,
Yes.
in the public health or community arena. That's outside of maybe just the hospital. Although you can do public health in a hospital, which is a whole
Yeah.
other conversation. But yeah, I would
Yeah.
say people that didn't have an idea of it, that's what it kind of means to me. Yeah, health promotion and wellness.
Yes, beautiful. Yeah. You said it very well. And so for you, what does a day look like for you now?
So currently, I'm working really with our partners here and a lot in Nigeria on health education, health prevention activities. So back home in Nigeria, I feel like there's not a lot of preventative health activities. There's just more of the treatment end, or when things kind of get out of hand. So
Yes.
yeah, so I'm really working on just teaching healthy practices and hygiene, having partners out there, really educate the locals on that, and everything from even some emergency preparedness like CPR and first aid, and those types of activities as we gear up for our next mission, which would be next year in 2021. So,
Wow.
yeah, we did have one planned in 2020, but COVID kind of put a big damper in those plans. So, but yeah, we're gearing up for next year fall, so that will be announced soon, and be recruiting some volunteers to go over and do um, some missionary work there.
Awesome. And so this is a great segue. So how is it working in healthcare during a pandemic?
Yeah, it's very challenging, especially initially. Um, I was I serve also as a administrator for some clinics here in the U.S. So a lot of my role is just getting, making sure my nurses, nurse practitioners, and providers are safe, practicing safe, and
Yeah.
protected in the midst of the pandemic. I think the most challenging thing is how rapidly things were evolving when
Mm.
the pandemic first hit. I mean, we started educating our healthcare professionals when it was still primarily in China and Asia. And then, just in case we had people come over that traveled. And then before we knew it, it's like, oh, it's in the United States. It's community spread. It's anyone could have it.
Yeah.
So it was like an all hands on deck kind of a deal with our clinics here. Just a massive race trying to get a hold of PPE. Everything is
Mm.
PPE, get PPE. Ordering it, everything was back ordered. There was a shortage. So we had those kind of challenges. And then other challenges that I think the public didn't really talk about a lot. Everyone talked about PPE and not having supplies, but there were a lot of issues on ground with just having my nurses and providers being scared. Me
Mm.
dealing with fear, everyone dealing with fear of a virus that you didn't really know much about. Because
Mhm.
usually we've had time in our field to understand other viruses and we can
Mhm.
teach it to other people. So we kind of had to put that behind us, fear of our families, ourselves, and just really just show up kind of on the front line. So it was definitely challenging, but I give God praise, to just be alive here in December and not be sick and all of that. So,
And so, how does faith play a role in all that you're doing, especially in nursing? How does faith play a role in your nursing career?
so there's this, I'm not sure if you're familiar with, but there is this song by a gospel artist named Phil Thompson. It's called My Response. And there's this hook I love, and it says, "You have rescued my life, and I'm never turning back." Um, basically says that you're my redeemer, and my response is hallelujah. And
Mm.
so I think of that song because it reminds me of my journey. I really feel that, God definitely rescued my life at a very detrimental, pivotal moment that, I was dealing with a lot of just internal turmoil. And I
Mm.
feel like he just changed the trajectory of my entire life and has
Mm.
blessed me so much and given me favor through my journey and brought me into this place where I am today. From being young, timid, shy, having self doubt, to being a leader of an organization and serving in leadership roles. So I feel like my response is praise in all
Mm.
that I do. And so, what does that mean practically? I feel that uh, whatever I do, whatever I say in my nursing role, in my healthcare leadership roles, it's praising God. So,
Mm.
I just take that personal, and I feel that I just have this calling to um, show the love of Christ in all that I do, inspire others by my journey and my story to never give up, and
Mhm.
not just, and that could be in anything, not just in academics or nursing, but even at the bedside, to not give up if you're faced with a sickness or a challenge, or if your family member is facing that, to just trust and have faith in God. So yeah.
That's great. So thank you so much, Faith. This whole interview has been amazing. Just hearing about your journey, and I wanted to ask, what advice would you give to someone who wants to pursue a career in nursing?
Sure. I would definitely give advice that, you know, to do your research. Do your research. There's so many avenues of nursing. And I say early on to do research about different avenues, not that you will know right away what you want to do, but just to understand the different options out there that are available to you. I think it's very important to kind of have a little bit of a roadmap of kind of where you're going.
Mm.
And when things get maybe difficult in school and you're like, why did I even pick this anymore? You can recall about some of the reasons why you wanted to even get into nursing and the different options. If you do your first clinicals and you're like, oh man, hospital work is difficult or this is hard for me, then you can be reminded like, oh, I don't have to just give up. There's different things that I can do, but this is a journey that everyone has to pass through. You go through nursing school, you may or may not start in a traditional role, but most people do. So I would say, yeah, definitely do your research and then do a little bit of internal work and um, find out if this is a passion of yours and if you're genuine about wanting to be in nursing. I would say nursing has been very good to me in a lot of ways, and it's very lucrative, but don't go into nursing because it's lucrative. It's,
Yeah.
yeah, don't do that because you'll burn out. And I've, I've I've been in this now, going into my 12th year. So I've seen a lot. I wouldn't change anything. I love this field, but I've seen a lot of people burn out and go into it for the wrong reasons.
Mm.
So if you're someone that truly, really wants to make a difference, whether it's right there at the bedside, in a public health role, in the
Mhm.
ICU, an insurance company, in politics, in so many different avenues. If you're someone that truly wants to make a difference, I would say go into it, but
Yeah.
do your research and prepare yourself. It's not an easy course. So if you need to, develop study habits like I had to back then, do that. I would also say find a mentor if you can early on. People ask me a lot, like, how do I even find a mentor? And sometimes it can't be easy if you don't have someone like that in your, I say, arena. The cool thing now about social media age is that I didn't have back then. There are a lot of amazing nursing blogs, and vlogs on YouTube, um, by other nurses that have gone through, what you're looking to go into. I would say follow them, even reach out to them, send them a message, ask
Mhm.
questions, send me a message. I love those kind of questions, and ask, I'm looking to be mentored in this way or this area. Yeah. And then finally, I would just say never give up, never quit. Um, you know, I would say that the scripture says that we can do all things through Christ who strengthens us. I truly believe that. That has been my testimony, as you guys have heard. Everything that God has shown me that He wanted me to do is what I have done. So, and I just give Him glory. So, don't be afraid to dream, and then you pray, you plan, and you move.
Amen. And before we end, I wanted to touch on the mentorship aspect. I
Yes.
know when you were, going through that struggle, did you have a mentor, like someone that poured into you at that time?
It actually took some mentorship and from another woman, which was my mom, God
Um,
bless her, that
Amen.
she was going through a career change in her own life. So she wound up back in school. So she she ended
Wow.
up taking classes at the same school I was. And so
Oh.
I'd see her often and we'd spend a lot of time together and she was like, "You know what? I don't think you have an academic issue. I think your issue is confidence. I think you have anxiety about test taking and math." So I just began to work on it specifically. Like I would take courses, non-credit courses on test taking strategies or my
Mm.
time management, for example. I took these courses that were offered and just worked on my self-development that way. And then as I also, I became born again during this time. So I just began to see myself as God saw me. So it was a combination of those things, my faith and practical actions that I took to develop self-confidence and to work on what I felt were academic weaknesses that really helped me get the right mindset and mind frame that, oh, I can do this.
Yeah.
So once I started, applying the tools that I learned, I found that my grades started to improve and improve and, improve a lot until I became, at one point, I had a 4.0 for a while. The same person that, I literally barely graduated high school. I don't even think, I didn't even have like a 3.0. It got real bad. At one point,
Gosh.
I was on like academic probation and all of that. So, yeah, I think those are the things that really helped me to overcome. It took just someone investing in me and believing and saying, you know what, I don't think that you're dumb, So
Yeah.
mom really spoke over me a lot.
Wow.
And she was there at times to literally kind of do hand holding. It's like, okay, let's develop, habits, study habits. I don't think I drove at that time, but I didn't have a car. So she's like, I'm dropping you off at this library. I'm not picking you up until, this time. So get it done, kind of a thing. So, yeah.
Well, thank you so much, Faith. So how can people find you? Like
Yeah,
what
sure.
platform?
Yeah, you can find me. I'm on Facebook. I'm on Instagram. You can follow my personal page if you'd like. It's at Faithfully. You can also follow our foundation. It's Yuval Foundation. We're on Instagram and our website, yuvalfoundation.org, to just keep up with what we're doing. Very soon, we're going to be announcing our next mission next year. If you're interested in public health, we've taken folks that are nurses, nursing students, public health people, physical therapists. So reach out to me if you have questions or if you're interested.
Awesome. Well, thank you so much, Faith, for your time. And thank you all for watching. I pray that you're richly blessed by this interview. I know I was, just learning about her whole journey. So if you are new to my channel, definitely subscribe and hit the bell so that you will not miss out on the next episode of Living with Purpose. Until next time, God's blessings always.